Hi, this is Amy Robbins. I'm a family nurse practitioner with Youthful Magnolia, and welcome to Youthful Magnolia After Dark. I have two guests with me. Our first is going to be our magnificent office manager slash the boss, Shayna Sturman. She's our person who keeps everybody together. And we have Liz Nelson, who's a RN and has her own practice here in Fort Worth called Liz Nelson Aesthetics. And we're going to talk about some fun regenerative aesthetics.
Okay. Thank you for having me on.
Anytime.
Staying late is fun.
She's off the clock, people.
Yes, I have clocked out. All right. Well, let's dive into these topics.
Okay.
Why would someone choose only an aesthetic treatment over something regenerative?
You want to take
So
that one?
something
Or you want me
like-
to start it.
Yeah. RHA filler versus like Sculptra or Radius.
Yeah, I feel like
Okay.
when we're looking at the history of aesthetics,
Uh-huh.
so many clients or patients coming in are thinking, I'm going to leave with a result that I came in for.
Mm-hmm.
And so that's where I feel like we're trying to change the perspective coming in
Yeah.
and think of it more of a long-term, gradual restructuring, creating something out of our own biology.
Yeah.
And so there's a shift for sure.
Yeah. I think so too. I also think that we've had a lot of med spas kind of pop up, and sometimes corporations kind of own these med spas. And I think some providers are really pushed to like do filler. And so when the patient comes, they're coming over with like, I want something on my cheek. And then you go over all the things, but I feel like some places kind of they sell what they have.
Yeah.
And so if they don't have a good grasp on what regenerative aesthetics is, I think it leads those people down that pathway. And so, I think it just kind of happens that way, unfortunately.
Yeah.
So.
It's interesting that you bring that up too, looking at more of a singular area to treat or fix, right? Because so many people come in for lips, for example.
Right.
I want my lips to be volumized. I want more symmetry or projection.
Yeah.
But it's training on both ends. So,
It is.
like with the corporate med spa, as you're saying, we want to sell this package and maybe upsell them to this.
Yes.
But in regenerative aesthetics, which we so much are passionate about,
Very much so.
we're looking at the global perspective and trying to retrain, if there's probably
Right.
a better description for that.
Yeah, I know. It's trying to get people to follow more of a treatment plan versus just coming in and getting like 2 syringes of filler and walking out and not coming back for
Like a
another
one and
year.
done.
Like
You want
Right.
them to be your patient,
your
be a
patient.
friend.
Yeah.
Yeah, be a part of us.
Be a
Right.
part of us. Yeah. So I think that's the other kind of part of it. But I do think, it's definitely driven by the provider and who's kind of pushing that product to those patients. So
Yeah.
And I know you were here all day. We didn't really get too much of a chance
I
to
know.
talk, but what were you doing before aesthetics?
Before aesthetics, primarily pediatrics.
Oh, okay.
So I've kind of dabbled a little bit all over the medical world.
Oh, okay.
Started as an EMT, jumped into the hospital setting, did a lot at Cook Children's here in Fort Worth, Harris downtown. So I just kind of dipped my toe in a lot of different areas, and that got me really passionate on like overall well-being and kind of like we were chatting before, interconnection just in
Yeah.
general, and how your reflection and your relationship with yourself can affect everything else, like your full life experience. And that kind of guided me into aesthetics in like this weird, crazy way.
Yeah.
And I really just enjoy being able to support someone's life experience, from that spiritual
Yeah.
level out to the skin.
Right.
and
That's
beyond.
great. Yeah, you did say you love skin.
Yeah.
Yeah,
That's
I
great.
do.
Yeah.
yeah, we
Yeah.
love skin here too.
She loves ZO too.
I know.
So, yeah.
Oh, yeah.
know.
That's a big one. Power
What?
player.
So when you started, you're about 7 years ago-ish in the aesthetics industry. So you kind of started when hyaluronic acid fillers were very popular and because that was really kind of the only thing you had. And so how have you how has it helped, how have you transitioned from kind of doing that to doing more regenerative type aesthetics?
It's crazy to think back on that, because beyond just like this, the HA is the fix kind of thing. If it's not tox, and tox was really IM, right? Like
Right.
treating that muscle movement.
Yeah.
We wanted to be frozen.
Yeah.
You know, that was the goal for a lot of people. And the HA fillers, it was also how many syringes can you fit into a face?
Yes.
Which, knowing what we know now regeneratively and anatomically, it's just crazy to think back to
Yeah.
then. Like, that's what we were doing. We are just filling a void.
Void.
And that's why I like science so much, because it's constantly changing.
Yeah.
And you're having to constantly study and relearn.
Right.
But moving into regenerative, like, and why I feel so passionate about it is it kind of goes, it's parallel to like functional medicine, right? Like, we're
Yes.
going back to what is the root of the issue. And for so many, it's environmental, it's
Yeah.
nutritional, things that are battling against what we're naturally created to do and to process.
Yeah.
There's like a Time magazine article that was talking about this generation is the most stressed generation.
Oh, yeah.
And, you know, they kind of talk about
Yeah.
all of those things, like beyond, you know, what we experience economically and politically, like everything that we're exposed to is just denaturing
Yes.
and messing with our natural structures and processes. So
Yes.
why are we not doing something that's going to biostimulate and tell our body to regenerate and to heal
Right.
things
Yeah.
that we were created
Yeah.
to do? That's why I love it.
It's fascinating.
Yeah.
Yeah.
It's really fascinating.
It's like never ending.
It's a slow process for the patient because it takes time. I call it vitamin T. They just need some more time.
Oh, I
Just
love
let
that.
this
Yeah.
stuff
Vitamin
kinda
T.
Vitamin T,
I'm
yeah.
going to incorporate
you're,
that.
you're missing some vitamin T. Like, just give it time.
Yeah.
And but I typically like to tell people, you know, this is a good 12-month process. Like, where this is not an immediate fix, and as much as we wish it was, it's just not. Like, that's where surgery can come into play. But you know,
Yeah.
even with surgery, like, they're not going to be able to fix, you know, bone reabsorption issues and
Right,
things like
exactly.
that. So
And then, you know, with that being said, and treating patients, how do you support regenerative results with like a patient with a chronic illness?
You want to
that's a
start?
hard one. I
You
can
wanna
start it. Yeah, so start with the conversation when they get there that, you know, a lot of what we're doing, we're relying on the patient's body to respond to these products we're placing in their body. And so if they are on, you know, medications that are going to block their inflammatory response to things, then these things may not work very well.
Yeah.
And I think it's, you know, it's nice when you have different, you know, you have energy-based devices, and those may work better for them. So, you know, you have our old therapy or soft wave, or, you know, we have our lasers. I think microneedling and things like that would be really beneficial for them. But if we're relying on something to happen in the face, they may not get the same result, and they might need more than what's the
Yeah.
recommendation for those particular products.
I think it's tricky, like in your partnership with your patient too, because when we have patients come in, and you're this way, you love and care
Yeah.
on your patients so
Yeah.
much. You want to invest beyond, you know, what you're physically doing with them. There's an emotional relationship and
Yes.
timeline that comes with that. You want to address lifestyle choices, and you want to add in things that will complement what would be their healing process, or what you would anticipate that to be, if they were ever going to be at a stable point where, you know, they had more complete well-being. But that's where, you know, things probably like peptides
Yes.
come
Yeah.
in, so you
Yes.
can support, you know,
So you can
supportive
support.
adjuncts
Yes.
to, you know, whatever their specialists
Yeah.
are doing with them, because you never really want to turn somebody away, you
Yeah.
know?
Yeah.
Yeah, you want everybody to feel like they're welcome into having
And-
anything done, and we just kind of have to figure out
We have a
which
different
way.
modalities, so
Yeah.
it definitely, I do feel like there is something here for everyone.
Right,
Yeah.
exactly.
Even as something as just a simple vitamin IV.
I was going to say,
just a little
vitamin IV
hydration
may work.
So,
Yeah.
Yes, yeah.
So, well, let's see here.
Uh-oh.
You know, working all day. Would y'all either prefer to work clinic in the morning or in the afternoon?
Oh, dang, that's tough.
Would you rather come in early and leave early or come in late and stay late?
I'm more of like morning.
Morning?
I wouldn't say like I'm a morning person, but I have that like ease in, knock it out. Like I'm going to bust it and then let's just, decompress or go enjoy the rest of the day.
I never leave.
Well, you don't. But what if you could?
Oh, okay.
If you could leave.
If I could leave, I definitely would prefer morning and kind of get off earlier and then maybe vary it. Maybe do a few days of morning and a few days late.
Or it depends on the
good.
treatment.
Yeah,
too,
that's
true.
probably. What does your day look like?
Yeah.
You like coffee in the morning or maybe like a shake? Protein shake, Jamba Juice.
I feel like I'm weaning myself off from the caffeine because it's like too much adrenaline.
So no sodas.
Yeah.
No sodas.
No sodas.
Okay.
Yeah,
Nice.
like the warm kind of things to like wake up the GI.
Yeah.
Oh, yeah.
First and the protein.
tea.
Yeah.
Yeah.
I like my Ula shots,
Yes. I have been doing Skin Aid, so
Oh, we
all
have our
know.
Skin Aid. I
Yeah.
like our Skin Aid.
little
get
vitamins
on
for
that.
the skin.
Yes.
Well, I'm just thinking.
Oh no, man.
No, this is just kind of funny though. Okay, well, so celebrities are all getting, some celebrities are looking good, some are looking young. Older women are looking so young. I
Yeah.
love that.
Yeah.
If you had a dream celebrity to inject,
Oh man, that is tough.
I guess it can be male or female. I kind of want to see what y'all's females would be.
Dang, that is tough. Amy can go first.
Oh man, that's hard.
Oh, or we can think about it and come back to it.
Oh wait, let's
Okay.
think about it and come back to it.
Okay,
I like
so
that.
thinking of okay, we'll just do a rapid fire. I'm just gonna ask two things and you just say.
Okay.
Okay.
All right.
Ready? Botox or filler?
Talks.
Talks.
Hamburger or hot dog?
Hamburger.
Hamburger.
Chocolate or vanilla?
Chocolate.
Chocolate.
No question.
Dress or jeans?
Dress.
I'm a jeans.
Heels or sneakers?
Oh.
I'm a heels.
50-50? I have to choose.
No. Airplane or boat?
I'm a boat girl.
Yeah, but
Boat. All right. Car or truck?
car.
Car.
Okay. Mexican food or Italian?
Mexican.
Mexican food.
Okay. Y'all eat oysters?
Yes.
Yes, oysters.
Yes.
We got a seafood girl.
Let's do
My
it. Good
girl.
point.
My girl who likes seafood and mayonnaise. We are good to go.
Friends for everyone.
Okay. Lips or cheeks?
Cheeks.
I like cheeks.
Cannula or needle?
Ah, it depends on
Both.
the area.
I say
yeah.
both. Both.
Most satisfying area to treat?
Ooh.
Can I
You
just
know
say
what I
skin?
like? You can say skin. That's a
Skin.
good one.
Skin.
I like when Amy just does a little chin.
I know.
It's like it's a very
Ooh,
subtle.
It is
Powerful.
impactful.
It's
It is
like it's
powerful.
game changer.
Frontal and profile. Yeah.
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 Yeah. It's just
I
like
can see that.
something that
Yeah.
doesn't really take long, but just
Yeah.
like, and then she's like, look at that.
Yes.
I love that.
Yeah.
Game changer.
Yeah,
Yeah.
it is. Okay, favorite skincare brand, but I think we're all on board with
Zio.
If you'd have a go-to hype song before clinic, y'all like more of a rap, more country vibe? Oh, you're a rap?
Blow a whistle.
Oh.
Oh.
Blow the whistle.
Oh.
Blow a whistle.
You had a little
That's-
twerk
yep.
sesh before you
Yep.
start. Okay.
Heck yeah.
Okay,
Yep,
I'm
that's the
down with
one.
that.
Yeah. You know mine. I've been like boring.
She's
I'm, like,
she's
little-
kind of a
like,
more like
lim-
chill vibe.
little chill vibe.
Yeah.
Oh, what is
I like
it?
some. I know. I like Luminaire Radio, like
Yeah.
Kygo. Just a little chill.
An ease in.
Little ease
Yeah,
into
she
it.
does it. She does it. Yeah,
Into her day.
yeah.
What?
Okay.
Blow a whistle. That's you like stepping into the next room, you know?
Yeah,
Yeah.
And you just walk in ready.
Yeah. You are ready.
Yeah.
Yeah.
Yeah. Well, I like that. Yeah. All right. Dream vacation spot.
Oh, dang.
You
there's so
travel a
many.
lot.
Japan.
I do.
Japan.
I haven't been to
Oh.
Japan. I'd go to Japan.
Yeah.
A little Okinawa action.
Yeah, all of
Okay,
it.
Yeah.
Okay.
Countryside, city,
Yeah.
beach.
Nice. Let's see. More of a country lifestyle. You like
Yes.
the horses, the pasture. Are you more of a rooftop type girl?
I mean, I'll do a little bit of everything, but I'd rather live country.
Country.
Quiet, peaceful. You can breathe.
Do you have animals?
Not right now.
Okay.
I have 3 kids.
Those are animals,
They
baby.
are like animals. They're like
There's a lot of energy.
Yeah.
Yeah.
There's
Yeah.
not a
I
lot
love
of
my
time to
kids.
take care of an animal.
Yeah,
Yeah.
exactly.
Yeah.
Yeah.
No. Yeah.
Yeah.
Yeah. No.
I've enjoyed Olive today.
Oh
at the
yes,
office.
we love Olive.
Yes. I
The sweetest.
think we could.
Yeah,
Yeah, I
make
think
her
she should
appearance?
She
make an
wanted to. She
appearance.
wanted to.
Oh, she. Oh, it's
Oh,
okay.
she's
She's asleep.
sweet.
She can stay asleep.
Olive. Ollie, sweet baby.
Come here, Olive.
Come on, Olive. Come on, Olive.
Come here.
Gotta make your debut, yes.
Hi.
She's just here, loving
Oh,
it.
she's-
No, she's like, I'm gonna stay close to Susan.
Mom, I have to be my mom.
Mama.
Oh.
Her mama's back there.
Yeah. Bye.
So sweet.
I love that.
All right, back on topic here.
Okay, okay.
How do y'all feel about doing aesthetic treatments now, or when someone's younger, to eliminate any type of correction or need for more procedures when they're older? So I mean, what are y'all's feelings about someone starting younger? 20s? We're seeing a lot of, 20s.
I think with the rise and all the GLP-1 medications and people starting that, you can start that at 18, I think. And I think you're going to see a lot more like volume loss in the face and stuff like
Yeah.
that. And so they're going to need these treatments a lot earlier. I do think that if somebody comes in and they're, in their mid 20s and are looking for like a cheek pop or something like that, I'm usually going to grab like a vial of Sculptra and like spread that across the face. Because then I'm going to really make some true like long lasting corrective work. And you don't have to worry about like tissue expanding around that hyaluronic acid
Yeah.
and causing like saggy tissue in the future.
Yes, sculpture's great.
I like it.
Yeah, I mean, I agree. Like, the GLPs for sure, fantastic medication for
Yeah.
so many people for
So
so many
many.
reasons.
Yeah.
Yes, great results.
Yes.
But then there's also the TikTok pressure
Oh, yeah.
with the skincare trends, right?
Yes.
And I'd rather them come in to see someone like us so we can guide them how to correctly care for their skin and skin barrier and things like that. And then, step them into other treatments appropriately,
Yes.
regeneratively.
Yes.
To maintain what that natural anatomy is, but support their confidence building,
Yeah.
Right.
And I think I feel like the younger generation is a lot more
Well,
on top
yeah.
of the
Yes, I was about to
knowledge.
say, I think the
Yeah.
younger generation, they do care
Yeah.
about their skin.
They do.
and
it's
they'll
a
put in
very-
the time to research.
And
They
I
will.
I think they will budget for it if they want it.
Yeah,
they will.
So I
They
think
will.
yeah.
I'm not even sure they budget. I think they just
Well,
do
yeah.
Yeah.
If they're
Commit
coming
to
in,
it.
they want something.
Right.
Yeah.
I want something
Yeah.
done.
Yeah.
Yeah. No, that's good. And I think that's good for girls. There's a lot of pressure though too that comes along with it that I
There
don't think
is.
we had. We weren't scrolling looking at girls, you
All the
know.
time. Yeah.
We
Yeah.
didn't have that.
And it's
so.
part of our responsibility,
Yeah.
as
To
providers.
talk to them about that and kind of give that expectation. So, and then telling them no.
Yeah, exactly.
Unfortunately,
Yeah. And we will.
I redirect a lot. Oh, you want to do that? Let's talk about doing a Moxie. I don't know. It's a
Yeah.
great laser. Let's
Yes.
clean your skin up really well. And they're like, oh, okay.
Yeah, it's a
Like,
really good
we
technique.
redirect a lot here.
Yeah.
Let's lead you down this way because
Right.
we need to take a pause over here. Let's go try this over here for a little bit.
Yes, I love that.
Yeah.
Okay, a little patient scenario. Let's do this again, part 2. Okay. So let's see. Let's give a little example of a patient and how we would go on with a treatment plan. 40-year-old women. Oh, wait. Okay. Okay.
Rewind.
Should I go younger than 40 or older than 40?
No, I love 40.
40 is
40's
good.
great.
40 is
That's-
good.
That's my.
Okay. Oh, no, I already said 40. I'm sticking with 40. Okay. 40-year-old woman, new to aesthetics, had a recent drastic weight loss of 60 pounds due to a GLP-1. Wants to come in. She's feeling herself. She's at her pre-baby weight and wants to get all the things done. Has never had talks. She wants some lips. And her main complaint is her jawline.
Okay.
And where would you start?
Well, I'd start with blow the whistle first. First. And then we start the conversation with clinical grade skincare for sure. Making sure that, we can do a little bit of correction, some protection, especially from SPF. We talk about how much she's in the sun, things like that. Then the next thing I want to know is, how is she eating now? Is she done with the weight loss? Is she on maintenance plan? How is she eating? So I can kind of anticipate what type of skin foundation am I going to be able to rely on moving forward.
Right?
And then we're ping-ponging, right?
Yeah.
Are you next?
Am I next?
You can go. Yeah.
All right. So she's coming. She wants lip injections?
She has small lips.
Okay.
She's not opposed to it.
Okay. So, yes. So, just, head to toe kind of situation, doing very much like talking about the nutrition side. But I find that starting with a neurotoxin treatment and medical grade skincare is like right up everybody's alley. It seems like it doesn't hit the pocketbook too much right off the bat.
That's true.
Budget.
It's just a good way.
Skincare might. but-
Skincare can. So, and then if she is interested in doing lips, I feel like doing like a little half syringe of lips or a mini lip helps. Just kind of give her
I
that.
do love a mini lip.
Yeah.
Like,
Yes,
give her
me
back a
too.
little bit of like something, and then she sees it. Like,
Yes.
it's something she sees. So, like,
Yes.
people like
Leave
to
with
see
something.
something.
I
They
do.
like to
And
leave
then
with something.
I think a lot
Yeah.
of 40-year-old women new to aesthetics, like just a little talks, when they are just like,
Yeah.
they love it.
Yeah.
They
Yes.
love
A little
it.
lip,
Or I
especially
think,
if they're
women
naive.
that their
Yeah.
crow's feet really bother them just a little. They
Yeah.
just, they kind of fall in love. And then
Yeah.
they're like, okay. They come back.
I
and,
trust you.
Amy, what else can you do?
Yeah.
Yes.
But I do have that conversation with, you have lost, quite a bit of weight, and
And that's tough.
yeah, it's tough.
That's tough.
It's tough because
That's
they look
tough.
older, and I think this is something that we really do need to talk about with patients, is when you lose fat in your face, those adipocytes have stem cells in them, and they make a big difference in like how your face looks youthful.
Yeah.
So if they've lost, fat in that face, you've got to figure out a way to like replenish that. So I do have that conversation. That's where, again, I love Sculptra, because now we're seeing that it's actually cell signaling a lot of like adipocyte activity. So if we can
Yeah.
place Sculptra in those like fat pads, we can get some more growth. But it's not something I'm like, they got to leave and have it done immediately. Like, they got to, let's talk about this. This is,
Yeah.
you took you how long to lose this weight? Let's
Right.
set a timeline as to like what we need to do to get your face back more youthful.
Yeah. And maybe for people that don't know about the GLP-1s and the weight loss, can one of y'all explain why, like when they're losing weight, they lose it? Here, you've heard of like the Ozempic face, or
Yeah, I mean,
know,
it doesn't. It's not gonna. It's a
It doesn't-
systemic
right.
treatment,
Yeah.
right? So
It's
it's not gonna discriminate.
discriminate,
Yeah.
where it's I want it on my arms, or
Right.
back
Yeah.
here.
You lose the tush.
Yeah.
like, all the areas that were supportive of
Yeah.
skin, and that skin, as we age, like it's going to continue to stretch. So you lose that support to whatever areas it chooses to pull from,
Yeah.
and then you have to re-support
Yeah.
those areas, face or body.
Is there like a go-to treatment for that?
Well, it would be like, obviously going back to our regenerative aesthetics. You can do Sculptra. Radius does really well. I kind of like to hybrid sometimes. I'll hybrid some hyaluronic acid with Radius
Yeah.
to give a little bit more of like I like not to say a punch, but just like a little bit more of a wow factor, because those collagen products do take time. And so when somebody's coming in and they're very concerned about how
Yeah.
they look, it's nice to have that hyaluronic acid to
Just
give an immediate
show it.
Yeah,
Yeah.
when you have that
Yeah.
full portfolio. I love
Yeah.
that option now, especially when we have regenerative in our
Yes.
pocket or in our
Yeah.
toolkit. you can just be a chemist or
Yes.
a
Oh, yeah.
scientist and,
Yeah.
and mix things
So
to
we-
get.
That's what we talk about with Amy.
Yeah.
About her special potions.
Yes.
Yeah.
And you can customize it specific to who's there and what
Yes.
their need is.
Yes.
Like,
Yes.
there's so many more options now than going back to just the
It's,
HA
Yeah,
fillers.
just a HA filler.
Yeah.
Yes.
There's a lot to play with.
Yeah.
Yeah.
Yeah.